Metastatic melanoma is the deadliest form of melanoma, with an estimated 76,380 new cases expected to be diagnosed in the U.S. in 2016. The incidence of melanoma has been increasing for at least 30 years, reinforcing the need for effective treatment options to fight this deadly disease. However, cancer experts are exploring potential ways to work directly with the body's immune system to help fight cancers like metastatic melanoma. Here to talk about melanoma, current needs of people living with melanoma, the burden of this disease, and recent advancements, and how new data melanoma cancer expert is Dr. Stephen J. O'Day, co-director of Melanoma Program, melanoma specialist, professor of medical oncology, director of Immuno oncology, director of clinical research at the John Wayne Cancer Institute at Providence St. John's Health Center, Santa Monica, California. Doctor, thank you so much for joining us today.
Thank you for having me.
So, doctor, why has metastatic melanoma been such a difficult disease to diagnose and treat?
So melanoma is one of the deadliest forms of skin cancer. And if it's caught early, it can be surgically removed and cured. However, it's one of the most virulent cancers that can spread very rapidly from the skin out into the body, and that's what's called metastatic melanoma. And once it's developed distant metastasis into the body, historically it's been extremely difficult to treat. It doesn't tend to respond to chemotherapy, and overall survival has been very limited, in the order of 6 to 9 months, and the chance of being alive 5 years is less than 10%. But the treatment of melanoma has absolutely been revolutionized in the last 5 years by the advent of new, very powerful, specific immune drugs that target T cells, which are Pac-Man cells in the immune system that normally protect us from cancer. So these immune cells activate and strengthen and build an army of T cells that then go out and eradicate melanoma. And it turns out, whether even using these powerful immune drugs by themselves or in combinations, there's now a significant proportion of patients with metastatic melanoma that can expect long-term survival and even possibly be cured of their melanoma even after it's metastasized. So this has been tremendous breakthrough in the field.
But doctor, how common is melanoma, and what are current incident rates?
So melanoma, we will see approximately 76,000 new cases of melanoma in the U.S. in 2016, with 10,000 deaths related to melanoma. It's one of the most rapidly rising cancers, and it has been increasing in incidence over the last 30 years. And it impacts people in the prime of their lives, often approximately 2 decades before the average age of onset of other major cancers. So it's truly important because of its devastating sequelae once it metastasizes and affecting people in the primes of their lives.
So, doctor, what is exactly immuno-oncology, and how is it different from other current melanoma treatments?
So traditional treatments like chemotherapy, surgery, or radiation for cancer really focus on trying to eradicate the cancer cell directly. Immuno-oncology is not so much about the cancer cell, but about activating, strengthening, and building an army of immune cells that then do the heavy lifting of attacking the cancer. So it's a very different paradigm shift. Now, with this activated immune system that hopefully is eradicating the cancer, comes potentially significant side effects that can come up rapidly and need to be dealt with. The good news is that we can manage these symptoms, and the vast majority will resolve with prompt treatment. But clearly there's a communication and a partnership between patients and doctors in terms of experience and reporting symptoms, so that these immune treatments can be safely given and accentuate the benefits but minimize the risks.
So, doctor, new data on immuno-oncology in melanoma was recently presented at the American Association for Cancer Research annual meeting. What does this data mean for the melanoma community?
So very exciting data came out of the ARC meetings this past week. We've known that the first immune drug that targets a receptor called CTLA-4 has led to long-term survival in approximately 1 in 4 patients. There is a different class of immune drugs that have targeted another receptor called PD-1, and the data from this meeting showed that approximately 1 in 3 patients with PD-1 inhibitors have long-term survival. But even more exciting is continued data with combinations of CTLA-4 and PD-1 in combination was reported at AACR now with 2-year survivals almost 70%. And this is the best data we've seen in melanoma. We hope as we follow these patients longer that more than half of these patients will remain alive long term. And this is truly going to revolutionize how we approach melanoma.
So, Doctor, how important are these recent treatment advancements to the melanoma community?
It's everything to the community. You know, the community suffered tremendously with poor prognosis in young adults and people in the primes of their lives. So for years, it was a very, very difficult disease, both for caregivers, researchers, patients, most importantly. Now there's this sense of hope. And not just hope, but tangible outcome benefits of long-term survival. So the field has truly revolutionized melanoma, but probably even more exciting, or equally exciting, is the fact that these treatments, since they're not targeting the cancer specifically, but the immune system, have been applicable across a number of cancers. So the lessons learned in melanoma are really going to help us treat cancer in general. And these drugs have already been approved in lung cancer and kidney cancer, and a number of other cancers are on the verge of having approvals. So we are in a revolution of immuno-oncology and a major paradigm shift in how we treat cancer.
And Doctor, why should people with melanoma and or their families do to learn more about immuno-oncology or the treatment options?
Well, I think with melanoma, the most important thing is to get to centers of excellence with doctors and teams of doctors that have experience with the disease. So that's number one. Number two, not all doctors have the same immuno-oncology experience with these immune drugs. Now, this is rapidly evolving, and doctors across the world are learning and excited about immune therapy. But make sure that your physicians not only have experience in melanoma, but in these immune drugs, because managing side effects as well as clinical benefit is critical. And the other thing is, be your own advocate and your family and seek out support groups. Melanoma has a number of local, national support groups, and do your homework and find out what support's available, because you are part of the research team and the clinical team. It matters how you're doing in reporting side effects, and it matters who you go to and how you get treated for long-term survival.
Thank you so much for joining me today, Doctor.
Thank you.